Hi, I wanted to start a series on something that I feel very passionate about, and that is survivorship. I feel like survivorship is one of the most underserved periods of cancer care. And so I wanted to go through a lot of the symptoms that I see and treat on a regular basis during survivorship, starting with fatigue. One of the most common questions that I hear from cancer survivors is, why am I still so tired all the time? Fatigue is actually the number one survivorship complaint. And whenever I say fatigue or cancer-related fatigue or treatment-related fatigue, I want to stress to you that it is more than just being tired or feeling tired. Cancer-related fatigue is very real. It is an extreme exhaustion. It can be physical, it can be mental, it can be emotional, but it's very different from just feeling tired here and there. This fatigue can really affect a patient's quality of life, and it can affect interactions on a daily basis. It can also inhibit them from being as active as they want to be. Fatigue related to cancer and cancer treatment can last for months to years after treatment is over. And that can be difficult because a lot of patients have family members, loved ones around them who, when cancer treatment is over, they think, okay, you're done with treatment, everything should be good now, right? But no, the fatigue can linger and it can really, again, affect quality of life. Why does it happen? Well, a lot of fatigue is related to the treatments that cancer patients receive. So chemotherapy can cause extreme fatigue that lingers. Radiation therapy is another cause of fatigue, and that's one of the most common side effects that I see patients report whenever they're getting radiation. Surgery is a very grueling process, and the body needs a lot of energy to heal. So surgery can cause fatigue, and then maintenance therapy and hormonal therapy can also cause fatigue. But we don't want to miss our medical causes of fatigue, underlying things like thyroid changes or anemia, heart and lung changes. Depression, anxiety, mental health issues, all of these can cause fatigue. Other things are lifestyle factors like disruption in sleep, poor nutrition, lack of movement, lack of exercise. So we want to make sure when we're evaluating fatigue that we cover all the bases. Now, there are some evidence-based strategies that we can use to combat fatigue. One of the most common things I tell my patients is exercise. So gentle, regular movements like walking, yoga, strength training, all of these things can help fight fatigue. It is a double-edged sword because when you feel very tired, you don't want to be active, but it can really help with those symptoms. Sleep hygiene is extremely important. So routine, limiting screen before bedtime, and then going to bed at a consistent time is also important. Nutritional support can help with fatigue. You want to make sure you're having balanced meals, and you want to stay hydrated, so drinking plenty of water. You want to stay up to date on your medical checkups as well, just to check labs like the thyroid function and anemia that I was mentioning earlier. You don't want to miss those things, which can be common causes of fatigue. And then sometimes if it's mental health related, you really want to make sure that you seek a counselor or maybe even cognitive behavioral therapy if it's indicated. I just want to stress again, fatigue is real. And it's not your fault. It's something that we see very commonly, something that we evaluate very commonly. And again, it's something that my patients report at their survivorship visits. It's one of the most common complaints that I see. Small, consistent changes can really add up. So thinking about all the things I mentioned, exercise, nutrition, good sleep hygiene, working on that can help. And remember that survivorship, it's not just about living well. It's not just about surviving. It's about thriving. So you want to make sure that your quality of life after cancer is as good as it can be. So just to recap a little bit, fatigue, real, not your fault. There are ways that we can help improve those symptoms. And if you are a cancer survivor, or if one of your loved ones has gone through cancer treatment and experienced fatigue, please share in the comments what has helped you with the fatigue. Share it below. Maybe we can help others who are going through the same thing. And if you found this helpful, check out some of my other survivorship videos that will be coming soon. I want to go through all the NCCN guidelines to talk about common symptoms during survivorship and how we can approach these problems in an evidence-based manner to help improve your symptoms and improve quality of life after cancer. If helpful, please subscribe and follow me for other survivorship tips. Thanks, guys.